Good morning. For those of you who are joining today, you are in CA3, Creating Opportunities During a Pandemic, the implementation of a homelessness and housing help hub, otherwise known as H4. My name is Kelly Gauze. I'm a coordinator of housing administration and development for the City of Windsor. And with me today, I've got Miles Soulier, who's also coordinator of housing administration and development with the city, and Ian DeYoung, who is the lead evaluator from Orcode Consulting, who conducted the evaluation of the H4 program.
We would like to begin by acknowledging the land on which we gather is the traditional territory of the Three Fires Confederacy of the First Nations, which includes the Ojibwa, the Odawa, and the Potawatomi. The City of Windsor honors all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land.
Just a little bit about Windsor, Essex. We are the southernmost city in Ontario. Our population is just under 400,000 people. We receive CHIPPY, Reaching Home, and municipal funding for our homelessness programs. We first established our Housing First program in May of 2015, and we do have two funded emergency shelters. One is for women, and it currently has a total of 12 beds. We also have another shelter that has a 26-bed capacity for men, and we utilize hotels for family shelter at this time. We also have one benevolently funded shelter, which has 103 beds for women, men, and youth. We've conducted 3 point-in-time counts, first in 2016, the second in 2018, and the last was just happened earlier this year.
So our objective today is to assist communities to find creative solutions to improve data collection while increasing housing outcomes. We would love for you to understand how Windsor Essex was able to leverage a variety of supports, including episodic care, mental health, and addiction supports for people experiencing homelessness. So, where do we begin?
March 15th, 2020, our world changed in a day. COVID-19 exposed the fragility of the housing and homelessness system. Not only were we trying to understand what this meant for ourselves and our families, but the sector was also tasked to try to keep our neighbors who were experiencing homelessness safe. This led us to a path where there was more uncertainty ahead than we knew what we were doing. During this time, we were often left wondering what was next, what we needed to do, while also quickly understanding what was not working in the system and what was broken, despite the work our community had focused on over the past 7 years. Just prior to COVID, Windsor Essex had been planning its third point-in-time count, and we had been closely following the work of our peers in the City of London, who had been doing work to bolster their by names list by offering a hub of supports over the course of a week or so, and we were looking into replicating a similar model.
That work led us here. This is an underutilized city facility in the downtown core. We turned this into our Homelessness DropIn program. We utilized city staff redeployed from a variety of departments, including recreation, provincial offenses, social services, and a variety of others. The lead for this program was actually a recreational supervisor who had knowledge of the space, the layout, the security requirements, and the staff that would be required to operate it. The basic kind of outline of this facility was that there was a gymnasium that we had set up with tables and chairs spaced 6 feet apart. Everything was designed with a COVID lens. In the top right picture, you can see that a temporary wall was installed to include a little space to isolate if someone did have symptoms and was awaiting referral to our isolation center. We offered very light snacks and a table and chair for someone to put their head down, or basically just a space to go during the day. We played movies, had a variety of games set up as well that were all encouraged from a distance. Importantly here is that there was no shower facilities. Here we actually built temporary walls to kind of block them off because of trying to work around the COVID restrictions around that was very difficult in this particular facility.
As the pandemic continued to go on, we recognized that things needed to change. City staff were being recalled to their home positions, and in the fall of 2020, through engagement and conversation with Orcode Consulting, we began to move the program from being a passive drop-in service to an action-oriented homelessness resolution center. So we approached our rapid housing and housing first teams who were knowledgeable with the population, were housing focused, and had already been engrossed in the processes around by names list, etc. As you can see from the chart, in October, we had Housing Information Services was designed as the lead organization for the program. This was due to their knowledge around housing supports, unit procurement, and rent subsidies. We also worked with Family Services Windsor Essex, who was our lead for homelessness street outreach. Again, knowing that engagement was paramount in ensuring the long-term success of the program. CUP, or Community Partnership, was on site to provide community engagement to the surrounding neighborhood, as the Waterworld facility is co-located in a large amount of social housing in the vicinity. And Canadian Mental Health Association was there through a contract with Ontario Works to provide mental health supports to those in receipt of OW. And for the most part, we were on the right path until we weren't. In February of 2021, our community faced its largest shelter outbreak. Our public health unit ordered our largest benevolently funded shelter to close, and the city was ordered to open a temporary shelter using a closed recreation facility. Again, this was a large city asset that was converted over the course of a few days to be called TSAC, or the Temporary Emergency Shelter - Aquatic Center. We were also, during this time, planning for a third point in time count and conducting mass vaccine clinic. To say we often felt like we were drowning was an understatement. TSAC, or the Temporary Emergency Shelter Aquatic Center, is a world-renowned aquatics facility that has hosted events like FINA for the world, and within a very short time frame, changed to being a 24-hour emergency shelter led by a collaborative of organizations leading our community's emergency COVID response. Those agencies included Hotel Dieu Grace Healthcare, Canadian Mental Health Association, Assisted Living Southwestern Ontario, Family Services Windsor Essex, and the City of Windsor. Staff at TSAC were provided by those organizations, as well as the affected shelter, otherwise known as the Downtown Mission. To say TSAC opened eyes with regards to the homelessness serving population and some of the struggles that they have accessing services and supports daily is an understatement. I love this quote because if you actually listen to the words, you understand that we say seeing is believing, but actually we are much better at believing than at seeing. In fact, we are seeing what we believe all the time and occasionally seeing what we can't believe. Again, we see what we believe all the time and occasionally see what we can't believe. For the most part, organizations participating at TSAC and leading the TSAC response very quickly began to understand how broken the system really was and how hard services were to access from a service user perspective. When leadership from health organizations were on site, understanding that people were refused to be taken to hospital and were actually quite sick, led to significant change in the system longer term. So in the midst of chaos, there is also opportunity. By having leadership on site at TSAC, service users were coming up and saying to them, how was it that a group of strangers have changed my life in the course of 4 weeks? How is it that housing is actually attainable when I thought for the longest time it was outside of my reach. There are thousands of stories for those folks that were supported at TSAC, but there was also an urgency that was around housing and ensuring that people that were there did not go back to emergency shelter, however, were discharged into housing. In a little bit, you'll hear from Ian from ORCODE, and he'll discuss the H4 evaluation and how, together with the findings during TSAC, were really the impetus for radical change within multiple systems. So the impetus of change was really the expansion of services to the population and how services were co-located with such urgency at H4 starting in April 2021. If you remember in the previous slide, you had seen 4 organizations that were listed. In April, those services were expanded to include a Hep C outreach team provided through the Windsor Essex Community Health Centre, Ontario Works co-located at H4 to provide assistance for people to access income support services and as a gateway to apply for Ontario Disability. Can-Am Indian Friendship Centre provided Indigenous supports, whether it was housing, addiction, mental health supports provided through a cultural lens. The Community Health Centre also provided a nurse practitioner, addiction supports, and an ID clinic for those who were required to get birth certificates or health cards. And the Community Response and Stabilization team through EMS were on site to provide ongoing vaccine clinics and COVID testing when needed. In process, we have work underway to develop a model for primary care to be provided on site through a partnership with the university. Probation and Parole is looking at co-locating some of their services to assist in decreasing the recidivism for folks experiencing homelessness into the justice system. And New Beginnings is looking to provide youth outreach in order to ensure that youth experiencing homelessness are triaged and intaked into the appropriate youth serving programs. So again, by highlighting the last few slides, we really began to understand how service delivery can change. It sometimes just takes a blip in the road to change from what we know to being radical and actually expanding and having very different and sometimes very difficult conversations with agencies and community partners about not just critiquing the services that are being provided, but helping them understand why services are so hard to access. Many times I was told, well, we don't need to put a nurse practitioner at H4 because literally it is half a block away. However, for a variety of reasons, people were telling us, even though it was only half a block away, that those services were unattainable for a variety of reasons, whether they weren't ready, whether there was barriers to accessing those services, or how they just wanted the services where they were going every day and didn't understand why that couldn't happen for them.
So as we began to change those systems, we really started to take a look at our data. And what our data was telling us was that we had wide gaps in data collection. We started to see things like as we were making those shifts in October to more of a housing-focused service, we started to see that we didn't really have the data to back that up. As people were getting housed, we weren't necessarily reporting it in their proper places. As people, were being housed, we weren't really counting those in the right places. So what we started to look at was collecting the qualitative data rather than just a quantitative data, which we're really, really good at. We can tell people's story, no problem. But what was very difficult for us to figure out was a system to allow us to be able to collect that data. That's into what we show all of our service users every day. And this is just some of it. So when users walk into the service, they are greeted with this signage, and it changes every day. Sometimes we report on number of vaccines given. You can see here on the left that we're talking about number of Thanksgiving meals served, which was 150. It's talking about the agencies that are on site, but really this is the guests' data. This is what they own, and we want them to show that we can help them here. We can help them get housed. We can help them get appointments with the right health practitioners. So we use this as just part of the story to tell. However, we figured out very quickly that we were in the Excel cycle. As we started to collect data, we just started to make a new Excel program for that. And then we started to make a new Excel tracker for this, and then another Excel tracker for that. Very, very shortly, we were at upwards of 6 different trackers that we were using to look at number of appointments with Ontario Works. We were looking at number of referrals to different services, number of unique clients that were coming in, number of clients that got vaccines, number of clients that, the list was endless, and we had just a mishmash of different Excel trackers that we were using. So we decided that we wanted to simplify our tracking a great deal to be able to provide a little bit of a better data outcome statistic for ourselves. So I really like this quote. It says, "Do you mind if I sprout some obvious generalities about information? If you have too much information and it's not organized in any useful way, then it can't help you make any decisions." So this really does apply to us. We had a vast amount of data. We had data about all the clients that we were working with. We had data about the referrals we were giving. We had data, about who was coming in through the door, number of unique people, number of times they entered the door, what times they were coming in. But we were really realizing quickly that it was a lot of manual processes to collect that data and then also report on that data as well. So we turned to something that we knew, and we turned to Hyphas. So as many of you will know, Hyphas is a data management program, and we had just implemented it with our shelter system here in Windsor, Essex. Our iteration for onboarding our partners was actually quite far down the list, but we decided to bump them up to allow ourselves to be able to collect better data and more consistent data from H4. So I have here on the screen, this is just a screenshot of the data that we collect every day. So you can see here the number of attendees that are attending our H4 program. And you'll notice that there are some gaps in days. So we're not perfect yet, but we're definitely making our way there, which kind of leads us into the data that we do. So we use Hyphas for collecting a large amount of data from clients. So we look at who has attended the clients, and we use the group activities module for that, for those of you familiar with Hyphas. We use case management to look at, the specific services that are utilized at H4. So if those are referrals to our health partners, if those are referrals to our Ontario Works partners, all of those different kind of internal resources that are being used, we're actually tracking that through case management. And we're also tracking the housing work that we're doing through case management as well. We use Hyphas for our incident tracking. So SORs and general incidents on site are all reported through Hyphas. We track service restrictions, although very few. We do have some clients that are service restricted, and we use the service restrictions module for that. And finally, and probably most importantly, we use Hyphas to track housing outcomes, and we use the housing placements module for that. So all of the clients that we are housing through the work of at H4, we are tracking that through the housing placements module. And of course, we're able to really get really rich data on, the clients that we're working with. We're looking at ages, demographics, we're looking at genders and the different types of resources and supports that they are utilizing while they're on site.
So really what began to change was the journey of a service user accessing housing and homelessness programs and services. On the right, you'll see a very mumbled and very confusing pathway. And for many, this is what it felt like: a bunch of wrong turns, a bunch of do not enters, and a bunch of one-way arrows where you needed to comply in order to access or to gain access to services and supports. What the H4 has allowed us to do is create laneways or pathways to getting a variety of basic needs met, including housing. With also comparing some of the data and looking at the data analysis, We've also been able to quantify that there has been a reduction in the number of days somebody is going from homelessness to housing because the services and supports are co-located on site at H4. So someone can come in every day and get help with doing applications for coordinated wait lists through social housing. They can get help with their primary care. They can get a meal. They can see the nurse. They can see an addiction treatment counselor if and when they're ready. If they're having a bad day and need to speak to somebody with regards to some of the stressors in their life, somebody is on site to do that in real time. Again, services are tailored for people when they need them, how they need them, as opposed to sending somebody with a bunch of appointment and referral cards to be addressed in 2 weeks' time. So for many people, the journey of their day-to-day and how H4 has really helped them has increased the number of people that our community has been able to house since April of 2021.
Hello, my name is Ian DeYoung. I'm with Orco Consulting, and I want to outline for you the ways in which we engage with service users and staff at H4 and the recommendations that we provided the community based upon those interviews and engagements. In February, on a Friday and Saturday, I spent the days at H4. What I had the opportunity to do was interview any guests that wanted to be interviewed. I also engaged and interviewed staff, reviewed operations within the physical location, and observed services in action. The interviews were conducted in a separate part of the physical building, away from other service users to provide confidentiality. Every single person that completed the interview was provided a $10 Tim Hortons gift card. There was nobody who didn't complete the interview, so everybody was eligible to receive the gift card. And the interview used a structured interview guide with some questions that were closed-ended and others that were more open-ended in nature. In total, we were able to interview 44 guests and 5 staff. Amongst those interviewed, the self-reported length of homelessness works out to an average of 3 years, and 2 out of 5 respondents that were interviewed had housing in Windsor at some point in the last 3 years. Interestingly, more than a third had never had a lease in their name or owned a house in their name. The overwhelming majority of service users were male. The average age of all service users was 43. 40% of people identified as Indigenous, and OW is the primary income source, with ODSP a close second. While some people had no income and many people were on OW, amongst those who were on OW, they are more likely to report health concerns and disabilities that may make them ODSP eligible. Over a third self-reported a brain injury, almost a third self-reported a chronic health issue, almost 2/3 reported a mental illness, and more than 3/4 reported an addiction. A quarter of guests, based upon their self-reported data, appear to experience comorbidity, and almost a third of guests appear to experience comorbidities. So what we're looking at here is the presence of mental illness, substance use disorder, and in the case of trimorbidity, the experience of chronic health issues as well. Comorbidities were considered those individuals that reported 2 out of those 3. Female identifying service users had some slightly different service needs than men. They were less likely to use H4, slightly. They did report having less income, and they're less likely to receiving assistance with housing. Of all people surveyed, less than a third reported having any form of identification. When it comes to discrimination, half of those interviewed reported discrimination when trying to access housing, and half reported discrimination when trying to access services. I'd note that those weren't always the same people. There were, for example, people who experienced discrimination in housing access that did not report experiencing discrimination in services, and vice versa. Almost 9 out of 10 of the people interviewed said they wanted housing. 50% reported that they're on a list for housing. Over 50% reported they were not receiving any assistance with housing. And interestingly, 3 out of 5 people surveyed said they would live with a roommate if it meant they could be housed faster. On average, people used H4 4 times per week. Almost all felt it was necessary, and the overwhelming majority, 9 out of 10, reported that H4 should continue even after COVID or at that time of the interview, post-vaccine. When asked about staff, on average, staff were given a 9 out of 10. And when interviewing staff, they clearly saw the differences that H4 was making, and staff were also able to provide some very interesting operational insights relative to the objectives of H4. All of this resulted in the forming of 13 recommendations. 1, we wanted to see an expansion in housing workers to the site. We wanted to see an additional housing support resources made available to support people in housing once they move. We recommended that there be signage and materials related to housing, that housing workshops be introduced once or twice per week that are very short in duration and emphasize the by names prioritized list, self-resolution, and housing expectations. It is also recommended that an OW caseworker be present on site no less than a couple days per week for at least a 4-hour portion of those days to help address OW matters in the field and directly with guests at H4. Related to health services, we recommended that health services be enhanced at H4 for all people with an approach to try and improve health and wellness needs of Indigenous people, as well as health and wellness needs of people who identify as female, given those two population groups was noted that we're not receiving perhaps the best possible health services that they could be. It was also felt that with health supports on site, when we looked at income, there may be the opportunity to help some people on OW apply for ODSP if it was verified in the opinion of health professionals that there was a justifiable reason for moving forward with an ODSP application. And we recommended that the H4 continue or be replicated post-vaccine, the consideration be given to a building more conducive to being a day service that could happen either through relocation or renovations to Waterworld, that trained peers and volunteers be used to assist with non-clinical, non-case management components. Consideration be given to consolidating housing assistance functions from other locations in the community and placed within the day service, so it would become an actual multi-service hub. Consideration could be given to anchoring street outreach out of H4, so that outreach workers had a one-stop service hub they could direct unsheltered people to in order to get their needs met related to housing. So that would allow outreach workers to do their housing work in the field as well as having a specific location to refer people to. And we felt it was necessary for the city of Windsor to play a leadership role in coordinating all the different complex services that could be offered at an expanded H4 service.
Very quickly after ORCode provided a draft copy of the evaluation, we went into action. We added the majority of the recommendations specifically coming out of our experience at TSAC and having senior leadership understand what some of the gaps in services were for each of those different things. We added 2 additional housing workers. We added supports, housing supports for folks that were housed out of H4 once they moved in. Signage and materials were created related to housing and that are prepared and disseminated. We have Ontario Works caseworkers on site actually 5 days a week. We are still working to introduce workshops once or twice a week, and those are under development. Additionally, health supports were our biggest win in the community. Health supports are on site to service both Indigenous peoples and for those that identify as females. The support and service took about 4 to 6 weeks for the folks to really trust the nurse practitioner on site. In addition, it was really important to get the staffing right. So a lot of work was put in with each of the different organizations to ensure that it was the right staff that were offering the supports and services on site. Again, acknowledging that if the staff that were on site were punitive or were not helpful or were not relatable, that the participants themselves would not access those services. So where has that led us? In a few short months, we've been able to take a council report to City Council for them to endorse the H4 for the longer term. The H4 has been recognized to resolving homelessness for those folks who were previously entrenched in long-term or chronic homelessness. And provided it really, really good in the evaluation around post-vaccine day services, which included recommendations on continuing the H4 to operate, that the building itself was not conducive to offering this type of service because, again, for the way that it was designed, it was never intended to be a homelessness drop-in or a homelessness response program. We need to work on expanding the use of peers and volunteers post-COVID to be able to assist with non-clinical and non-case management components of the H4. Again, by offering H4, we were able to consolidate housing assistance functions from other locations in the community and place it within the day services to create the actual hub. That actual hub has, again, gotten the traction that it needs longer term to resolve homelessness. So we are looking at co-locating and maybe expanding to include a coordinated entry into shelters. Actually looking at potentially co-locating our centralized waitlist program at H4, again, going where people are in real time. Also looking at considering anchoring outreach services out of this location. Again, homelessness street outreach is the best when it works on the streets in real, planned, very predictive type routes. However, by being able to bring outreach services to the H4, again, allowed a population that maybe was a little bit reluctant to accessing mainstream services to be able to build that trust with the staff at H4 to be able to address some of those longer term items that needed to be addressed. And again, continuing to demonstrate that the city plays a leadership role in coordinating the very complex array of services to be offered for the homelessness population. This is Bryn. Bryn also provides some really good therapy in the space. One of our staff had gotten a puppy and had brought her in one day because it was raining. And by doing something so simple has led to a large impact. The way that she is able to de-escalate when some folks become escalated in the space and has provided a relief for them to be able to actually start to work through some of those traumas. So much so that we're actually looking at incorporating this piece into the longer term permanent hub to include some type of animal therapy for folks experiencing homelessness. And I would just like to close by saying thank you. Thank you to the amazing staff at H4 who do the hard work each and every day. You'll see they are from a variety of organizations, but their commitment to this population and their commitment to ending homelessness is within every one of them and within all of their being. H4 would not be what it was if it wasn't for each one of their faces coming in every day and really working to support the population with compassion and helping individuals feel like they belong and giving them that place to just come in and decompress when they need to and to actually work on resolving homelessness when they're ready, willing, and able to.
So on behalf of Kelly and I just wanted to say thank you so much for taking the time out of your day to listen to how we created a day service and how it has really grown over time. So if you do have any questions, we'd be happy to field them. I think we'll be moving into a question and answer period at this point. And then certainly Kelly and I are available with our information on the slide here. We would love to hear from you and be able to kind of share any resources that we have or any experience that we have as well. So thank you very much, and we look forward to your questions.